Does your partner complain about your snoring? I'm Dr. Neelakshi, ENT surgeon. And snoring isn't always harmless. Snoring happens when air can't flow freely through your nose and throat during sleep. Common causes: blocked nose, enlarged tonsils, or excess throat tissue. But here's the concern. If you snore loudly and stop breathing for seconds while sleeping, that's sleep apnea. Sleep apnea means your brain isn't getting enough oxygen at night. This increases your risk of heart attack, stroke, and diabetes. Did you get something like loud snoring, gasping for air, morning headaches, and daytime exhaustion? Simple snoring can be treated. Sleep apnea needs medical attention. Don't ignore it. Your heart depends on good sleep.